Bethesda Health has found a lot of things wrong with me that I was unaware of. I originally came here for high blood pressure. I got diagnosed with congestive heart failure. If they hadn't found it, then it could have progressed to be a lot worse.
Bethesda Community Clinic is a nonprofit clinic providing free health care to anyone in need. What sets us apart from most places is we don't have a lot of requirements, we don't require any identification, and we remove all barriers to health care. So we want to be a healthcare home for people, and we are fully mobile, meaning we go to where the people are, where they live, work, play, and worship. My mom is the founder of our clinic, and she became a nurse practitioner in her mid-50s. And while working at the health department, she quickly realized that there were no primary care services for people who were uninsured in our county other than going to the emergency room.
If Bethesda didn't exist, I'd be going to the emergency room a lot more. And last year I was hospitalized 8 times. Dr. Jacobs has really been amazing, and I go everywhere to come visit him.
My name is Lee Jacobs, and I'm the medical director for 16 years for Bethesda Community Clinic. We cover many areas that have homeless, like this area we are at today, but we're also covering people who have bad insurance or no insurance, which is a big part of it. The majority of people we care for have bad diabetes, have bad blood pressure. The numbers you never see in a general medical office. They're so high because people have not had care. However, the biggest need is mental health. People are generally very depressed or very alone. Loneliness is an epidemic around here.
We used to have a bricks-and-mortar clinic in Holly Springs, and we realized after a certain number of years that our patients were having trouble getting to our clinic. We had a lot of no-shows and a lot of people that just couldn't get a ride or get there on time. And so we opened our mobile clinic while having our bricks-and-mortar clinic at the same time, and quickly realized that we were able to see so many more patients if we simply eliminated that transportational barrier. Going fully mobile was a big decision. Prior to going fully mobile, we were a sliding scale clinic. So the first thing, by dropping the bricks and mortar, we also became a fully free clinic, which opens up opportunity for more people to come and receive care without a barrier. One of the most important things for us is access to quality primary care services. So access means meeting people where they are, finding creative solutions to make sure that everybody who has a need gets those needs met.
Oh, I would think that the only way to really provide comprehensive health to the people that need it, people without transportation, is to go where they are. And that's why the mobile units are so critical, providing health care in the vulnerable populations that have the need.
Unfortunately, the quality of construction of our first unit was done with low quality materials, and unfortunately a company that I'll call fly by night and no longer exist. We really found that we needed somebody not only with a reputable company, but someone who stood behind their work with warranties and was proud enough to put their name on the side of our vehicle. There are several reasons why I chose AVAN. First of all, I was interested in a vehicle that is easy to drive. Our current vehicle is 28-foot box truck, and most people that are my employees or volunteers do not feel comfortable driving such a large machine. And then we live in Georgia, which is full of hills, and so it doesn't make sense to have a vehicle that you can't pull in and out of a driveway because it's so low to the ground or it wasn't built to be on the hills. So I knew that a Sprinter van was going to be my next purchase. I love the idea of a Sprinter van because, again, people can drive, and also you can get into places that you can't with a bigger unit. Another reason that I chose AVAN was the high quality of construction. Everything inside of the van is commercial grade. For me, that was a game changer.
It's been a huge game changer for us. Just the other day, I did an EKG in there, brought our equipment in there. It fit in there perfectly, had plenty of space, and that's also very accommodating for patients too, to feel like they have space in a closed environment. And it also just creates that sense of privacy as well, which patients really need and really want. It takes a lot in you to come to a free clinic. I think people have a sense of pride with themselves, and it's hard not to lose some of that when you're going to a quote-unquote free clinic. But by creating an environment that's comfortable and accommodating and non-judgmental, it kind of lifts that feeling, and they feel like they're at home with us. They feel like they're with family.
I'm very grateful with Bethesda. My dad's come here because he doesn't have insurance. This service gives us hope. They need to have more of these clinics in not only Cobb County. I think that in a different county, I think that they need most Bethesda.
I believe that everybody deserves love. One of my favorite things is just getting to know the patients and loving them as individuals and letting them know that they have a home with us at Bethesda.